we are unable to answer any question, you will be reached via email. Also, the recording of this webinar will be available on our website, www.mtbc.com, within 2 business days. To tell you a bit about MTBC, established in 1999 with more than 1,000 employees and 24/7 operations, MTBC is one of the fastest growing companies in the United States. We are currently serving 39 unique medical specialties in 40 states. MTBC is also Microsoft Gold Certified Partner and an Inc. 500 5000 company. We are ranked among Deloitte Technology Fast 500. MTBC services include an ONC certified electronic health record, revenue cycle and practice management services. In today's webinar, we will be covering what ICD-10 is all about, its transition timeline, comparison between ICD-10 and ICD-9 structure, what needs to be asked from the payers, what are GEMs, what providers need to know about it. We will also talk about the impact of ICD. We will also talk about the impact of ICD-10 and MTBC's E-claim module. Apart from that, we will also tell you about 2 very useful applications, iBill and standalone ICD-9 to ICD-10 converter. Let's get started with ICD-10. ICD-10 is the 10th revision of the International Classification of Diseases and Related Health Problems listed by the World Health Organization. ICD-10 allows the counting of diseases, injuries, symptoms, reasons for encounter, and external causes of disease and death, such as accidents. Now, such health information is used for prevention, managing health care, allocation of resources, outcomes monitoring, research, clinical context, and primary care. So ICD-10 codes will range from 3 to 7 alphanumeric characters. There will be a massive increase in the codes as they will increase from 14,000 to approximately 69,000. They will be more specific and will have the flexibility to add more codes. As far as the ICD-10 transition timeline is concerned, the deadline to begin using ICD-10 is October 1st, 2014, which means that we are left with very short time and all HIPAA-covered entities must make the change to ICD-10. Implementation of ICD-10 on October 1st, 2014 will extend, again, is a myth only. So it is very important for all the providers to get ready for this transition, as on October 1st, 2014, the ICD-9 code sets will be replaced by ICD-10 code sets. If we compare the structures of ICD-9 and ICD-10, we see that ICD-10 contains 7 positions instead of 5 which were in ICD-9 case. ICD-9 codes will only covered numerical codes, whereas ICD-10 codes are alphanumerical codes, and this is because of the increased specificity of diagnosis. The first code of ICD-10 will always be an alphabetical code. To get more into this, characters 1 to 3 will represent the category of disease. Character 4 will be used for the causes and origin of disease. Character 5 will define the body of part affected. Character 6 will be for the severity of illness. And the 7th character will hold the place for extension of the code to increase specificity. One of the important concerns that most of the providers has is what needs to be asked from the payers in terms of change. This includes if they are or will be releasing any ICD-10 payments policy, will they be sharing their revenue mapping? Will there be any need of prior authorization for the ICD-10 code submission? and any need for the renegotiation of the contract. Well, to get an update on this, we request the providers to read newsletters of your peers regularly and to get in touch with your peers to get the relevant information. Majority of the providers are already aware of GEMs, that are general equivalence mappings, a tool that can be used to convert data from ICD-9 to ICD-10 and vice versa. GEMs are also known as crosswalks, as they provide important information linking codes of one system with codes in the other system. The ICD-9 may have a single match or multiple matches with ICD-10. But also there are few codes that don't have any match with ICD-10. So they can only be used as a reference index. A very typical question that comes in mind is, why do you have to care about GEMs? Well, because it's a technological change, the providers needs to make strategic decision to use the ICD-10. Without standardization, it is likely that affected physicians, facilities, and peers will come up with different versions of mappings and crosswalks. The use of ICD-10 codes will impact almost every aspect of the industry. Therefore, the practice revenue will be dependent on the reasonable and appropriate interpretation of the ICD-10 code set. What changes providers may face, and what are some of the possible impacts of ICD-10? Because ICD-10 transition is new to everyone, the entire billing cycle from the patient's visit to the payment of the claim will be affected. It may take some time in understanding the ICD-10 completely, so it's going to be a time-consuming process. There are also chances of errors in coding, as the number of codes will be increased to approximately 69,000. The number of pages of superbills will also be increased, and ultimately increase in the paper costs and increase in the time and efforts for documentation. Keeping all these facts, challenges, and possible impacts of ICD-10, MTBC's clients need not to worry because, as always, MTBC has worked upon these potential challenges and has come up with the best solutions. Yes, it is the E-claim module incorporated in the web EHR. E-claims module is a tool where providers can easily convert data from ICD-9 to ICD-10 and vice versa. The users can search the codes either by description or by code. It also enables both forward and backward coding, that is, from ICD-9 to ICD-10 or from ICD-10 to ICD-9. More about E-claim modules. The E-claims module has a very user-friendly interface. 2 radio buttons, ICD-9 and ICD-10, will be available, and if the user needs to search the ICD-10 codes, the user has to click on the ICD-10 radio button and can search the desired ICD-10 code either by description or by code. It will also not require typing the complete description of code, but just providing the initials of the description or code. The user will be able to see the relevant codes or description. The E-claim module will not only search the ICD-10 codes, but will also help the users to find the corresponding ICD-10 codes. For example, if the user needs to know what are the corresponding ICD-10 codes for the ICD-9 code 250.12, the user just needs to click on the ICD-9 radio button, and in the code search option, type the ICD-9 code 250.12 and click on search. The E-claim module will then show the ICD-9 code as well as its corresponding ICD-10 codes. So on your screens, you can also see the interface, which is pretty user-friendly. And by easy search criteria, it will give you more information, more knowledge about ICD-10. The same will work if the users search for ICD-10 code. The E-claims module will show the ICD-10 codes along with the corresponding ICD-9 codes. The selected ICD will appear in the diagnosis pop-up window. There will be two sections on the left side. ICD-9 codes will appear, while on the right side, ICD-10 codes will appear. The user can add up to 12 ICD-9 and ICD-10 codes at a time. As mentioned earlier, the deadline for ICD-10 transition is October 1st, 2014. This means that till that time, the providers should be using ICD-9 and can gain knowledge of ICD-10 codes by using the E-claims module. Some of the benefits of E-claims module. The E-claim module can easily overcome the challenges, as with the help of it, inappropriate codes can be avoided. Delays and denials in the claims will also be avoided. It will help to reduce the risk of interruption in revenue. And finally, the administrative cost will be reduced, resulting in improved efficiency and performance. To overcome the ICD-10 challenges and impact, MTBC has also launched a groundbreaking application called iBill. It is available for both Apple and Android devices. This app allows physicians and their staff to enter claims through handheld devices on the go. Some of the important features of iBill are speedy claims entry, built-in ICD-9 to ICD-10 converter, full integration with web-based scheduler and practice management system. The users can view appointments, patient's eligibility, and payment details, and many more. So you can download this application from Apple Store and Google Apps. Likewise, in the E-claims module, iBill also has a user-friendly interface and can easily be used to find the corresponding ICD-10 codes. Provider can search the desired code either by description or by code. A search pop-up window will contain Start With and Contains Radio button. Search would be dynamic if the user selects Start With. For instance, the users can type just the letter A, and all ICDs starting with letter A would appear dynamically. Same goes if the user searches for ICD-9 codes. A pop-up will appear to the user showing the related ICD-9 codes along with their corresponding ICD-10 codes. We have also launched a standalone application called ICD-9 to ICD-10 Converter. This will also help our providers to transition from ICD-9 to ICD-10 smoothly. It's a knowledgeable tool where users can search their most used ICD-9 codes against each ICD-10 codes and help them memorize and recognize their ICD-10 codes. Just download it from App Store and use it today to get the knowledge. More about a standalone app, the user can search ICD-9 to ICD-10 codes either by description or by code. A pop-up will appear to the user showing the related ICD-9 codes along with their corresponding ICD-10 codes. The user can also search the most recent used ICD-9 codes by clicking on the Recent ICD-9 tab. At the moment, the providers are familiar with the most used ICD-9 codes, but not with the ICD-10 codes. Providers can save a lot of time by using our E-claim module and smart apps. These will also help them memorize their most used ICD-10 codes against their ICD-9 codes. Now, MTBC's ICD-10 tools and resources. To know more about ICD-10, MTBC has established a Provider Resource Center containing more information about ICD-10. If you have any questions or suggestions, you can also send us an email to icd10@mtbc.com, or you can log on to mtbc.com/mtbc-icd.aspx to get more information on ICD-10. Okay, I'll not go back to the E-claims just to give you more about this module, because since the ICD-10 transition is very near and the providers are left with a very short time, MTBC has already established this E-claims module, and you can simply switch over to our web EHR and you can utilize this module. Like mentioned, that it will have a search field for diagnosis that will contain begins with, and the user can simply type in any code or description and can search for either ICD-9 code or ICD-10 code. The good thing about this E-claim module is that from now onwards, whenever a provider needs to know what would be the ICD-10 code for any searched ICD-9 description or code, this module will go ahead and tell you and show you whatever the matches of ICD-9 and ICD-10 are. But like the deadline is October 1st, 2014, you can use this tool to gain knowledge, but still you have to use ICD-9 in order to process the claim. And also for those who just wants to go ahead and to know more about ICD-10, you can go ahead and you can download our iBill application, because it has the tool of ICD-9 to ICD-10 conversion. And to gain more knowledge about it, the user can simply search for the codes, the ICD codes, type in the description, and it will give you the corresponding ICD-10 codes. So it's a good tool to get started with and to gain more knowledge about ICD-10. I will now take a short pause to retrieve the questions, and we'll continue with the question and answer sessions. You can use your webinar panel to send in your questions. So we'll just take a pause and I'll be back. All right, thank you for the hold, and we're getting some questions. So the first question is that would there be any change in the implementation of ICD-10? Well, the simple answer to this is no, there won't be any change in the deadline for ICD-10. And it has also been announced by CMS in the recently concluded HIMSS conference. Let me get more questions. It's been asked that, is this the provider's or practice responsibility for the renegotiation of the contracts with payers if that is required? Well, the providers and practices who are directly in contact with payers are responsible to check with their payers whether there is a need of renegotiation of contract or not. So it's important for all the providers to get in touch with all of your peers just to ask them if they have any changes, or if there are any such required changes, then they should be dealing with them. Okay. The question is asked about our applications. They're available for all the handheld devices. Either it's an Apple iPhone, or if that's an Android phone, or if that's a Windows-based phone or tablet. This application can be downloaded and can be used on all of those operating systems. We're getting more questions? Right. Another question is that who is affected by the transition to ICD-10? Well, everyone covered by HIPAA must transition to ICD-10 by October 1st, 2014, which means that it is not only limited to Medicare, So it's for all who are covered by HIPAA. Now we're getting more questions. So right, there's a question that what planning is needed to do with the clearinghouses or pairs. Does MTBC will take care of it, or does individual practice needs to contact the pairs? Well, as far as the contract negotiations is concerned, we request the providers to get in touch with the pairs. Whereas the submission of the claims of ICD-10s is concerned, MTBC will be taking care of it. Because we have actually created the module for that. So whatever the ICD-10 codes will be, MTBC will be testing them and will be providing all those resources to the providers. And just to let you know that the testing is already done with the clearinghouses. MTBC is already done with the testing, and it has been successful. So whenever this transition will take place, our providers needs not to worry, because they can simply use the E-claim module and they can start sending the ICD-10 codes, as MTBC will be processing them. Right, there's another question that if ICD-10 codes can be started right now. Well, you can start practicing them, but like I mentioned before, that the deadline is October 1st, 2014. Before that, the providers must be using ICD-9 codes, but after that, it will be important, or it will be a must for all the providers to start submitting ICD-10 codes. So just for your knowledge, just for the practice, you can even select those ICD-10 codes on our E-claims module, but originally you will be submitting ICD-9 codes till the October deadline. I'm trying to get more questions. Please stay with us. Yeah, similar question that if the transition is done early to ICD-10, will CMS be able to process the claims? Well, no. CMS and other peers will not be able to process claims using ICD-10 until the compliance date, that is October 1st, 2014. Another question is that, is switching to ICD-10 an option? Well, it's not an option, because claims for all services performed on or after the compliance deadline must use ICD-10 diagnosis. Claims that do not use ICD-10 diagnosis will not be processed after the deadline. All right, we're getting more questions. Okay, there's a very good question, that is, will there be a grace period for submitting ICD-9 claims after the deadline? Well, to answer this, the Centers for Medicare and Medicaid Services has stated that it will not accept claims using ICD-9 for discharges on or after October 1st, 2014. So from that date and forward, only claims encoded using the ICD-10 code set will be accepted. We're getting more questions. Right, there's another question, which is, can the mapping systems such as GEMS can only be used? Well, many mapping tools do not drill deeply enough for the 4th through 7th digits. Also, because there is not always a one-to-one mapping between ICD-9 and ICD-10, mapping tools cannot always provide definitive codes for a given situation. So to gain more and advanced knowledge is very important for all the providers regarding the ICD-10. All right, so we're getting more questions. Okay, we're getting more questions, and there's a question which is asked is that, does MTBC make sure if the clearinghouse is accepting the E-claims module? Yes, like mentioned earlier, that MTBC has already done the testing with the clearinghouses, and MTBC will determine if the payer is accepting claims with ICD-10. Then yes, of course, as soon as the ICD-10 implementation will take place, our system is already tested and ready for that, and we make sure that all those E-claims with ICD-10 will be processed through our E-claims module. All right, and this also same goes for the payers as well, that they are accepting the claims with ICD-10. We will make sure that, if they are accepting it, only then we will be able to process the ICD-10 codes through the E-claim module. Okay, it is asked that, is this expected delays in claims processing from the payers and the insurance sites? Well, since this change is going to be new for everyone, so yes, it is expected that there will be a delay in order to get to know more about it or to streamline the process. It is expected that it may take a little longer for the claims to be reimbursed. All right, so getting more questions, please bear with us. All right, we are retrieving more questions. Please bear with us. Okay, it is asked that the recording for this webinar will be available or not. Yes, within 2 business days, you can go to our website, that is www.mtbc.com, and the recording of this webinar will also be available. All right, we're trying to retrieve more questions. Please bear with us. Okay, on your screens, you can also see the contact details. If you have any further questions or any comments, any suggestions, you can always reach us at ICD-10@mtbc.com. The webinar link you can also see on the screen, that is www.mtbc.com/webinars.aspx. If you need to contact us, you can always call us at 732-873-5133, extension 308. We will try to see if you have more questions or not. Please bear with us. Okay, we're getting some questions regarding providing the trainings on our applications and on our E-claims module. Then yes, MTBC's Meaningful Use team will be contacting the providers. You can see the contact details on your screen. In case if you need to have any kind of a training sessions, any issues, any problems, we will be contacting the providers. We will be giving them the trainings. We will let them know how they can use the modules in order to continue with submitting of ICD-10 codes and so on. All right, please bear with us. Let me see some more questions. Okay, I believe we're not getting any further question. Once again, on your screens, you can see the contact details. You can always contact us at ICD-10@mtbc.com. You can see the webinar on mtbc.com/webinars.aspx. Now, this concludes our webinar for today, and please stay tuned for our future webinars as the transition process continues. Thank you all for joining us today, and have a wonderful day. Goodbye.